A Bardstown man battling cancer can't get the surgery he needs to remove a tumor because his hospital doesn't have enough beds. It's an issue we're seeing across the state. Focus investigative reporter Paula Vasan shows us new data explaining why it's happening.
This is the dream home Joe and Gary Borland built nearly 2 decades ago. Outside, it's quiet, peaceful, serene. But inside, their hearts are heavy.
I feel this tremendous sense of loss and fear.
Married for 38 years, this is the hardest thing they've gone through. Worse, they say, than when they first learned in March of his diagnosis.
Stage 4 colon cancer.
But now, there are more unknowns. Because getting the help he needs isn't certain.
It could cost me my life.
After rounds of chemotherapy, he needs surgery to remove a cancerous tumor. But right now, he says hospitals don't have room for him.
That they are at capacity.
To me, it's just not right.
A spokesperson at U of L Health Jewish Hospital, where Gary's waiting for an appointment, says they're seeing a surge in COVID patients. About 95% of them are unvaccinated.
And I may lose my life for what's happening right now.
He got vaccinated against COVID back in January to minimize the threat of becoming infected. He didn't foresee this threat.
That he is being forced to suffer the consequences of other people's decision not to be vaccinated.
His love of biking put on hold as his body takes a toll.
It's draining everything out of me as far as energy.
But what's more painful, he says, is the memory.
It kind of brings everything back to me.
He remembers returning home after the Vietnam War in 1971. He was a medic, treating the most seriously wounded.
We were always just, looked down upon, kind of pushed aside.
Pushed aside, he says, by a country that saw the Vietnam War as unwinnable and veterans as undeserving.
I had people spit on me.
Decades later, that feeling has resurfaced.
Again, that's the way I feel.
Along with a new fear.
That he won't survive cancer.
Are you surprised by what this family is going through?
I'm not surprised.
Nancy Galvani is president of the Kentucky Hospital Association. She's sharing their new research with us for the first time.
What we're living in is unprecedented.
On any given day in Kentucky, 82% of hospital beds are filled, according to their research. For specifically beds in the intensive care unit, they are nearly 90% occupied.
The sickest of the sick have to be prioritized.
This problem isn't just about available beds, but about a strained workforce.
We don't have enough nurses to staff all the beds we have.
For Gary, that means it's harder to find the right doctor, on the right day, at the right hospital, with the right equipment, like finding a needle in a haystack. How would you describe the situation that we're in right now?
We're in a crisis.
A crisis worsening by the day.
And it's putting a huge strain on our hospitals and the ability to care for not just COVID patients, but others that need hospital care for non-COVID related illnesses.
What's the solution?
We have to have a greater portion of our population vaccinated.
What's your message for people who don't want to get vaccinated?
I would ask them to consider the strain that is being put on our healthcare workforce. And by getting the vaccine, you're actually helping to free up beds for other people that need to be in the hospital.
People like Gary Borland. He couldn't stay outside for our entire interview. A side effect from chemo. He felt dizzy from the sun, leaving his wife with an empty chair.
It's forcing the unimaginable.
She's not ready for their love story to end.
38 years worth of love.
All because her husband can't get into a hospital.
It's very painful.
So for now, she prays he'll sit beside her for longer.
Absolutely.
She prays for a hospital bed. She prays for a future.
And I cannot imagine life without him.
Gary should have been in surgery this past Friday, but that couldn't happen because there were no beds available, and doctors still don't know when one will open up. In a statement, a spokesperson at U of L Health tells us, the number of COVID-19 patients admitted to our hospitals is the highest we've experienced at any other point of the pandemic. We acknowledge the recent procedure delays are even more heartbreaking because they are avoidable if more of our unvaccinated population got vaccinated. Right now, Joe and Gary Borland are pleading with lawmakers to set up alternative facilities for COVID patients so that they and others like them can stop waiting. For Focus, I'm Paula Vasan.
This story actually came from a viewer who reached out to the Focus team. If you have something that you'd like them to investigate, you can send an email to focus@whas11.com.